I can remember a time when we didn't have combination vaccines, and the discussion by parents were, why do we have to give our kids so many shots? And now we have individuals who are saying maybe we should give our kids more shots. In my opinion, just from being a parent and from somebody who administers vaccines to children, I prefer the combination vaccines because it means one less stick into the child. I think that what the president had talked about was that, oh, but there's so much in that one shot, maybe we should spread them out over time. And actually, there's very good science to say that when we give multiple vaccines at the same time, the responses are actually better from the immune system because the entire immune system starts working to fight all of those things. We have been giving the pertussis, tetanus, and diphtheria vaccine as a combination for longer than I have been a physician. Similarly, the mumps, measles, and rubella, or MMR vaccine, has been a combination for quite some time. In fact, many people think we should have more vaccines combined together. We get asked every single year, when will they have a combined flu and COVID vaccine so that adults don't have to get 2 shots? Why are we making children get more? But more concerning is talking about changing the tried and true schedule for childhood vaccines without any evidence to suggest that that should be done. And especially when we start talking about delaying vaccines for infants, because the problem there is infants often do not have the antibodies already developed, and they don't have carryover from their mom's antibodies when they're born, so that they are at risk for some of these illnesses. I remember when I was in medical school, almost every night that I was on call in my pediatrics rotation, we were working up a child for meningitis. Now that we have the vaccination against Haemophilus influenza type B, my residents have never seen a case of childhood meningitis because it was so revolutionary that that vaccine helped protect all children from a disease that, again, I remember distinctly having to deal with every single day. I've also heard people say concerns about, well, the varicella or the chickenpox vaccine. Oh, but chickenpox is this mild disease. Again, I remember from before the time when we had that vaccine that I was admitting children to the hospital for severe cases of chickenpox, and in fact remember having children die from that disease. It is not necessarily a benign childhood disease, and that's in my lifetime. Those physicians that are the generation before me remember those same discussions talking about mumps, measles, rubella, and polio. We have virtually eradicated those diseases due to vaccination, and we need to continue to work to eradicate more diseases with vaccination, and we need to continue those vaccinations. And the childhood vaccination schedule is designed to do just that, to protect our children.